introduction, and also thanks to the ICH team, Rajesh sir, organizing such a CAB in a difficult time of Ogoya and also the cyclone. So I'm going to say about Horseshoe kidney. So here we have a case. So you have a case of 10 years boy presented with 3 days history of fever, lethargy, decreased appetite, and occasional colicky abdominal pain. On examination, the dehydration is there, tachycardia, and temperature 1 degree Fahrenheit. Blood workup shows neutrophilic leukocytosis and deranged urea and creatinine, and urine analysis shows the plenty of pus. So it's a case of urinary tract infection, and we did a ultrasound. It shows some structure. It's probably a Horseshoe kidney. So now, overview of Horseshoe kidney. It's the most common fusion anomaly, and incidence is about 1 in 500 birth, and most common in male child. The ratio is about 2:1. So what's the problem with the Horseshoe kidney? So there is a fusion, mostly in the lower part of the kidney, leads to the structure looks like horseshoe shape, and it's happened in the 5th to 9th weeks of gestation. I already discussed, and the kidney stays in the lower lumbar region and L4, L5. The isthmus, it could be a functional renal parenchyma in majority cases, or it could be fibrous strand only, and it could be lies in the midline as a symmetric Horseshoe kidney, or it could be shifted to one side as a asymmetric Horseshoe kidney. So during development, if you see here actually, so the initial kidney is developed as pronephros, which is a very short period of time stay, and it's a non-functional, and then disappear. After that, there is a one kidney mesonephros. It's an intermediate and suboptimal functional. It also disappear, and final kidney is formed from the metanephric blastema, that is metanephros. But the problem with the Horseshoe kidney, it's fuse the metanephros and leads to the Horseshoe kidney. And the kidney is developed in the pelvic area. It's need to ascend to the normal position in the upper lumbar region, but it's stuck in a inferior mesenteric artery and leads to the problem. It's make the kidney as a ectopic kidney. And here other problem with the Horseshoe kidney is that kidney is man-rotated, not fully rotated. So and also the ureter. The ureter is also passing over the isthmus and placed anteriorly. So there is a high chance of obstruction and urinary stasis, and all this led to urinary tract infection and stone formation. So what is the cause of Horseshoe kidney? So exact cause is not known, but there is a lot of syndromic association there. They are like chromosomal syndrome. And here is a one case. Studies mention that they disrupted the SONA head gene at neural floor plate, and they found that there is no problem with the nephrogenesis, but there is a problem of fusion of the kidney and also the neural tip defect. So, what are the associated kidney problem in renal problem in Horseshoe kidney? So, the associated renal problem in the Horseshoe kidney is the reflux, that is around 25%, and obstruction like Pujo, pelvic urinary junction obstruction also up to 25%, and the kidney stone I already mentioned, and other problem like ureteral duplication, ectopic ureter, ureterocele, and retrocaval ureter can be there. An external problem is the syndromic association. So here is the syndrome like Edwards syndrome. Up to 75% of Edwards syndrome could have a Horseshoe kidney. Turner syndrome and Down syndrome could have a Horseshoe kidney. Also, this same condition associated with the genitourinary and gastrointestinal syndrome problem and vertebral anomalies is there. So, how the kidney stone is formed, I already mentioned. So here is a study that shows they have a pool incidence, took the pool incidence of 943 patients, and that shows that around 36% incidence of renal stone. And most common stone is calcium oxalate. So hypercalcemia is there, and next is the calcium phosphate also there. So most of the kids present asymptomatically, and after doing ultrasound for any other reason and detected the Horseshoe kidney, and they could have a pain, weight pain, or they present as a urinary infection or stone disease. On evaluation, mainly for a nephrologist point of view, we'll check as a CKD. So we'll check the routinely check the creatinine and the proteinuria, and also we'll do a ultrasound if there is already there is a history of previous ultrasound shows any abnormality in the antenatal period. For viewer, if there is a history of urinary tract infection and ultrasound shows hydroureter or hydronephrosis, then definitely we go for MCUG to rule out viewer. DMSA scan has some indication to doing DMSA scan here. If there is a kidney already has a raised creatinine and ultrasound shows abnormal echogenicity, and to identify the functional tissue of the both kidney and the differential function of the kidney. DDPA only we can do if there is a indication of obstructive picture like in ultrasound showing some picture, then we go for DDPA scan. So what else other complications for Horseshoe kidney, like they can have a chance to develop malignancy and a quite a high, not so high, let's say 2 to 4 times high transitional cell carcinoid kidney, Willis tumor, and carcinoid syndrome. And also they have a chance to get a trauma because the kidneys lies anteriorly and over the vertebral body. So there is a chance of trauma, especially the isthmus. What is the long-term outcome of the Horseshoe kidney? So here is some reports coming. So they have checked 146 patients, the age of more than 20 years, and they found that obstruction, kidney stone, urinary tract infection, and urogenital cancer is about 26, 25, 90, and 4% patients. And the incidence of end-stage renal failure about 2.6 per 10,000 person year. So another case series of 41 patients, and they found that renal scarring is about 24%, and they develop the proteinuria also 14% patient, and also there is a presence of hypertension, and child may enter into the chronic kidney disease like ESRD also. So next, last question I have discussed actually that Horseshoe kidney could be a potential donor or not, because that will be issues. The kidney is located ectopically, and the problem is the nephrectomy, the donor nephrectomy, because we could remove the divide the isthmus, and there is a vascular issue, the availability of the vessels. So there is some case series actually about 9 cases reported successful donor nephrectomy and transplantation from the Horseshoe kidney. So if I summarize my presentation, it's a rare anomaly. Probably we are missing a lot of kids because 50% is asymptomatic patient, and maybe associated with renal external condition and increased risk of UTI, stone, and they may enter into the end-stage renal disease or malignancy. So these kids need a long-term follow-up and subsequent management. Thank you.